I'd like to direct my first question to Ms. Fox and Mr. Bean. Last summer, President Obama proposed a new tax credit for small businesses that offer quality health care to their employees. Specifically, under his proposal, small businesses would be offered a refundable credit of up to 50% on premiums paid on behalf of their employees. Some have recently expressed questions about whether or not such tax credit would be sufficient given the dire circumstances that most small businesses currently find themselves in and the difficulties associated with restraining costs and maintaining cash flow. Given your policy expertise in this area and your understanding of the circumstances that many small businesses currently find themselves in, do you think that a tax credit would do enough to encourage small businesses to provide health care coverage for their employees, or would additional incentives need to be offered?
We're very supportive of the tax credit proposal that's in President Obama's plan. We think that it would go a long way. EBRI did a survey on that and surveyed small employers that didn't offer coverage. 71% said they would be interested in offering benefits. Now, that was a little while ago, before the economic downturn, but 71% said it would make a big difference. We're finding in Insure Oklahoma that really is being very successful, having some assistance to provide benefits. So we do think it would be helpful, but we think it needs to be more. We need to rein in costs across the board, so it needs to be a multiplicity of approaches.
Good. Mr. Bean?
Yes, well, we believe tax credits are really probably the key help that we can give small business, and we'd like the tax credits to be refundable, and I think that they need to come monthly. They need to come at a time that a business can use them, be refundable. I support and we agree with the concept, and specifically I think most small businesses in our surveys want to provide health coverage for their employees, and they think they need to from a competitive standpoint because often they're competing with a big company. You put these things together, if you can just give some financial help so that it's not a question of paying the mortgage at home or getting some health coverage for the employee, and I think the one way you can really get and affect and help small businesses with the refundable tax credit issue.
Anybody else care to comment?
Yeah, if I could comment briefly, I think tax credits are a good idea. I think it's necessary, but they only achieve one of the objectives that I think ought to be the focus, and that is to get more people covered.
Sure.
I think a targeted tax credit, and I think it needs to be a little larger than 50%, because after all, that's not a lot more than simply making it deductible. I think a targeted tax credit that works against market forces is very important. I think we need a tax credit that has enough effect on the market to reduce overall cost. And that's one of the reasons I would frankly prefer the Choice Act solution over a simple 50% tax credit.
Anybody else? Okay. More broadly, do each of you have thoughts, or do any of you have thoughts on various options that are out there that are designed to ensure that a higher percentage of small businesses are able to provide their employees with health insurance? Should the federal government be encouraging the development of purchasing groups, which would increase plan choice and lower administrative costs, subsidize insurance coverage for high-cost individuals, subsidize insurance coverage for low-income individuals? Any thoughts about any of those proposals?
I'd say yes to all three of those.
Well, consensus, huh?
We think that supported groups for certain individuals is one way to deal with with the small business problem of the unhealthy individual. We don't want to see. I know the law is everybody. It hires equitably and doesn't base things on health, but you wonder out there, we've got to give options to businesses because we can't bankrupt businesses, especially now when things are tight. And I think all of those proposals have appeal to the small business community.
Any other comments?
I think that's a huge deal. I think it would help immensely between the tax credits and the pooling. No one here has had the problem of if you have 4 or 5 employees in their 30s and you have one who's in his 50s, the rate just goes right through the roof. Or you have someone has a pre-existing condition, forget it. They won't write the policy. So I think that'd be a huge deal to get more people signed up. And again, we still have to address the cost issue of controlling costs. That has to go along with it.
I would just
Clark?
say, as from the provider standpoint, anything we can do to see more coverage. We're seeing a dramatic increase in our bad debt, as you would imagine. We're to the point now where 50% of the babies born in our OB unit are born into the Medicaid program. And so anything we can do would be helpful.
Thank you all.